Hi, Deborah. It's really great to see you again. Today's visit, we're just going to go over some of your concerns they had with chiropractic care and your osteoporosis. I know that you said that you heard fast adjustments are the only way, and you're wondering if chiropractic care is still something you can be seen for. The answer is yes. We can still adjust you and help you with your pain. We can help increase some movement back into places that might be a little stuck and decrease some stiffness that you might be feeling. Since you have been diagnosed with osteoporosis, which is like a natural aging thing and kind of reminds me of a sponge. When we're young, um, our bones are strong and sturdy like a dried out sponge. But once you got that sponge wet, it kind of gets softer and it's easier to break. So kind of like when we age. Um, because of this, we would look into using some alternatives due to the risk of chiropractic adjustments. As with many healthcare procedures, there are complications like fractures, dislocations, injury to the squishy part that's in between your spines, and um, you may be sore or stiff days following an adjustment. You can also have some serious complications like stroke. We do our best to obviously not have these things happen in our clinic, which is why we do take such a thorough history and physical exams. We love that you brought your scans into us so we can look at those as well. We just want to avoid all those complications. And because of that, we would probably take a different approach with you, which isn't a bad thing. It's actually would be really beneficial for you. We can do different techniques that are just going to be lighter than our adjustments that we do with our hands. So we have this little thing called an activator, and it sends a force just like an adjustment. It's just way lighter and it's more specific. So it'd be great for you since you probably should not be getting a full thrust that chiropractors usually do to deliver adjustments. We can also do things called mobilization. So basically, we just take a joint and we just create good, healthy movement in that joint to help bring that back. You can also do things like soft tissue work to help relax the muscles around those bones and different parts of your body where the pain and stiffness may be happening. We also have a fun, awesome table that creates a thing called flexion and distraction. So what it does, it actually helps open up the space in between your spine, the different segments, and that can get a lot of relief for that. And I know we talked about some of the concerns last time about your osteoporosis and just your everyday life and how you heard about swimming. Swimming is great. I love that idea for you. If that's something you're really interested in, I'd love to incorporate that into our treatment plan. There's also a lot of other things that you can do too. Exercise in general is great. It's great for building up bone strength and muscle strength, especially the muscles around those bones. Um, I wouldn't say go out and do anything crazy and do this whole new crazy workout that you heard of and that you've never done before. But since you're really interested in swimming, I think that's a great avenue into starting to work out. Um, there's things also like supplements. There's research on calcium and vitamin D that have been really beneficial for patients with osteoporosis. But that's something that you would definitely want to call your primary care physician for and talk to them a little more about. And as always, you don't have to go through the route of chiropractic if you don't want to. There's other phenomenal people that you can see. You can see a nutritionist, you can see a personal trainer, you can just go to your primary care physician. Some people see an orthopedic surgeon. It is just what you feel most comfortable with and what you think is best for your body. All right.